Welcome to Bite Size Dental Marketing. We're here today with the lovely Dr. Jung. Dr. Jung was born and raised in Seoul, South Korea, where she earned a Bachelor of Arts in Child Psychology. After moving to the United States with her family, Dr. Jung received a Bachelor of Arts with honors in biology at the University of Texas at Dallas, where she graduated on the Dean's Honor List. At Baylor College of Dentistry, now known as Texas A&M College of Dentistry, she was a member of the Odontological Honor Society. That one's always a mouthful. The Dean's Honor List, the Dental Scholars Program, and a mentor for the Pre-Dental Enrichment Program. She also earned a certificate in education for healthcare professionals from the Texas A&M School of Graduate Studies. She graduated with a Doctor of Dental Surgery degree and was recognized with the Merit Parks Award. After receiving her degree, Dr. Jung continued her studies through the Advanced Education of General Dentistry program. Dr. Jung is a member of the Academy of General Dentistry and the American Academy for Oral Systemic Health. Dr. Jung has also been chosen to receive the Best Dentist in Dallas Magazine Award in 2021, 2022, and 2023. Finally, Dr. Jung, and this is a prestigious one, has been awarded her fellowship in the Academy of General Dentistry, a distinction that only 6% of all dentists have achieved. On a personal note, Dr. Jung has been married since 1994 and has two beautiful daughters and is now the proud grandma of a grandchild. She's a foodie and loves hot yoga. Dr. Jung, thank you so much for being here today. It's lovely to have you.
Oh, thank you, Ian. And also thank you so much for having me. It's such an honor.
Of course. So clearly, with all of your awards and being on the dean's list, and I mean, best in Dallas 3 years in a row, and going back from as early as being a mentor to to uh, to younger scholars, you have a love for dentistry and for oral health. Could you share with us a bit about where this love for dentistry came from such an early age?
So, not only age, because when I got into dental school, I was already 40. This was
Oh
my second
wow.
year. Yeah, I was a teacher before. This is my second career. So, I'm the oldest student in the building. Um,
Wow, that's amazing. I did not know that. Sorry.
yeah, I mean, it's great. But when I become a dentist, I don't want to be just another dentist around the corner. Is there something I can offer to the patient and actually make this better world
Mm.
as a dentist? And there's a lot of connection. Our body and our mouth is really literally under your nose. It's there,
Yeah.
and even half of stroke and heart attack is coming from a gum disease producing bacteria.
And is that just understanding all of that, and when you found out that that's where how all of these things are connected, is that what drew you to dentistry?
So no, when I first started, I really didn't know about it, and so when I got into dentistry in the first place, actually it was my husband's recommendation because we like to have some mission trip together, and dentistry can be a very great tool to reach out to people.
Mm.
So it's just a tool to reach out to people. That was a main reason I got into dentistry. Then when I know about more dentistry, there's a lot more into that I didn't know about. The really systemic connection between our mouth and a whole body system. And that's more like, oh, I'm not really treating their gum disease. I'm treating their whole body. And I'm
Wow.
preventing their Alzheimer, stroke, heart attack by just make their mouth healthy.
Mm.
That was a really great commitment and very simple and easy, but still can have a great effect on people's life and that patients people around the patient people's life. So I'm very grateful that I have that opportunity to do that.
Yeah, amazing, amazing. And as I just mentioned, clearly you've never stopped learning. And you said, although you went into this not knowing much, of course, about dentistry and growing and realizing that it's more about the body than just about the mouth. When it comes to becoming one of the 6% of dentists, getting that fellowship in the Academy of General Dentistry, and everything you had to go through to achieve that. What was your motivation in wanting to achieve that? Where did that passion come from?
I'm just seeking the answer to have a better answer, because what
Mm.
I know just not enough. Once you know more, then I realize that I don't know enough. So that's a very natural way of going to trying to learn more, because there's one
Mm.
leads to another. But about this is my new perspective of a journey, not only the gum disease, only systemic health. And let me tell you about my story, because when I got into dental school at age of 40, I had a very I kind of weird teeth. You can say that. I
You
have.
have such beautiful teeth. What?
Oh yeah, yeah. I had a braces 3 times already. But when I got my first braces, it was a mistake. I have a really prominent canine all over the place. I have to remove one tooth and just braces upper. And then I realized my bite was not aligned, just some weird bite going on. So when I got into dental school at early 40s, I had a second braces, which is at the time I have to remove the rest of my teeth. I lost 4 teeth total to make my jaw align, not jaw, the teeth align to make it straighter teeth.
Wow.
I'm in the late 40s. All of a sudden, I have a kind of got sick in a very weird way. So I had a cough for almost a year, dry cough, and no one knows what that is. And so, when you go to see the doctor recommends you some medication. Then if they cannot figure out, they send you the specialist. Then when you see the specialist, then they also the course of action of taking this medication. If it works, then great. If it doesn't work, it's just a brutal course of action. You have to just figure out what was going on. But during that time, I got sicker. At one point, I admitted to ER because I could not breathe.
Oh wow.
And after that, they actually had all kind of tests. I turned out to be they developed that I developed cough variant asthma. And also, doctor told me that, oh, by the way, one of your rib was broken because I was coughing too much. So and
What?
then there's another medication spray, and also I developed some allergies, the skin rashes. Seems like my body's falling apart. But after that, I was okay. This is not the right way, because after you take the medication, I developed upper respiratory infection so often. Then you have to put another medication addition to that. At that point is it's a crap stuff for better way to heal myself. That's why my journey started to seeking the answer is a better way to heal myself without medication. And then actually I read a book Breath by James Nestor. It's recommended by my yoga teacher actually. And then through that journey, like there's a kind of really eye opening moment of why our jaw development was an issue in this modern society. And also the author had that certain treatment for jaw developing through the one doctor in New York. His name is
Hmm.
Dr. Bell. And when I read that chapter, I was this is it. This is my answer. I need this treatment. And I contacted Dr. Belfort and asked him I needed treatment. And Dr. Belfort said that either I treat you or you learn how to do this so you can help your patient. That's my journey got started to learn about the jaw development, why we need a jaw development, what was wrong in the first place, me that instead of jaw development for my teeth to accommodate my jaw to accommodate my teeth, instead lost a teeth, make my jaw even smaller. So it was a
Hmm.
bad
And
that
was
is.
was this? I just quickly, just for timeline, was this your story leading up to dentistry, and why you realized that you would go into it, or at what point in time did it happen where you realized?
Oh, so this is the after after I graduated from the advanced education, I actually opened. I bought the practice. So I've been practicing about kind of 5 years at that
Hmm.
point.
Hmm.
So First, I was general dentist who does a lot of cosmetic implant. Uh,
And that was your moment of realization that
then,
there's
yeah,
more to dentistry.
right. Then after that, 5 years later, because during that time I had a lot of education how to treat this many other issues that we people have. I'm trying to have a better smile and better gum health, all that. But I failed to look outside of the mouth.
Mm, mm. And
I
that,
was trying to only look through the loop, through the
mhm,
magnification, looking for the cavities, gum disease, smile line, all that. But outside of the mouth, I never thought that is how our jaw, how alignment from head to toe
makes a difference.
connected
Mm, mm,
to this point.
mm-hmm.
So
Because
that
that's
that
an argument. I've heard that argument with clear liners as well. For some, I spoke to a dentist out in the UK who
mm-hmm,
had spoken. He specifically, I think he actually works with an institute, with a Harvard Institute actually,
mm-hmm,
either the Oxford or the Harvard Institute, and they are just focusing on how realigning the teeth can heal spine issues, golf players with their swing, how after finding essentially where it was misaligned. Once it was aligned, they could hit the ball much further than they did before. The injury
mm-hmm,
before having to have surgery on a knee, they would say before you do surgery, let's try and realign the jaw, see if that has it, and it would just completely heal that problem. So, I mean, I'm there with you when it comes to understanding what incredible impact the alignment of the teeth and the mouth has with the rest of the body.
Yeah, I mean that's absolutely I agree with that. So just really root cause of that is coming from our jaw is underdeveloped these days, modern society. Is from our the modernized food, which is 60% of our food are processed food, which is
Mm,
soft diet. We used to chewing things.
mm,
But there's everything is soft. You can just swallow almost every food. Not only that, lack of breastfeeding, because during the breastfeeding, that make our tongue to working, toning the muscle. Tongue is a very big thing muscle. It's a big part of our airway. Not only that, a certain bite will make our jaw growing in the proper way. But when we're losing all kind of ability to develop our jaw, it make our jaw little lot smaller. It's just even compared to 300-400 years ago. And our
mm,
jaw, and especially mid face, is a lot smaller, and our nasal airway is not lot narrower. That lead to we have the same amount of the teeth and same size with the tongue, but we have a smaller jaw. That means there's a teeth is all over the place. No wonder. And
mm.
because of the big thick tongues is right there that occlude our airway. That when we had that the space issue, our body has to find a way to breathing. Then lead to our had little forward posture to just open up the airway because their big thick tongue just stuck there. Even when you're laying
Oh,
down, sometimes you cannot people cannot laying down and sleep because tongue is for back.
mm.
There's so they
Is that
have
where sleep apnea also comes in
it
these days? That you think it has to do with the jaw and the size of the mouth?
absolutely
Oh,
because by definition of a sleep apnea, there's a collapsibility of the muscle. The big part of big muscle is really tongue.
mm.
And when we do not have a toned muscle of the tongue, or there is just flat back,
It
then
stops that. It
they
stops.
oh
It
yeah,
creates that obstruction.
because we have a pipeline, but we need to stay open the pipeline.
Yeah.
Part of that. And also jaw, yeah, and also you mentioned about jaw alignment. And I'm not just talking about jaw alignment regarding our eye level and ear level. Of course, it's jaw teeth level and
Mm.
also shoulder level.
Full
And
symmetry.
yeah, that alignment and head to toe and right and left sides when it align, our move is very easy. Every
Mm.
movement lead to gas and fluid exchange in a beautiful way. When one part of a stop or it's just not in the right way, rest of the body has to figure it out. But that why our alignment, our head and the rest of the body has to be go together. So even as a dentist, we cannot just see our teeth line to our other line of either eye line or ear line. We have to see, is it line with the shoulder?
Mm.
How the rest of the body? How people walk? And that was a lot of clue that we can see that affect our bite. Even one single crown can mess up our whole posture. And all about the braces, if we make teeth straight, disregarding our face, the cranial structure, we can more harm than good because we can lock our system.
Mm.
So
Yeah,
when you mentioned, yeah,
there's
go
a
ahead.
term that the gentleman I spoke to, the specialist, he said, I think it's not tongue, is it tongue tied or something? It's like, or the jaw lock. He had mentioned exactly what you just said about the jaw lock and saying when that happens, it just creates a whole list of new problems. And one of the cases that you could maybe talk to that I know has caused problems is these fast braces, or even Invisalign, if it's not done correctly, moving it too quickly has the ability to also have that same effect. Could you maybe speak a bit to that?
Right. So, I brought my Mr. T. If you
I
can
love
see,
it.
his is, you can consider that as his is our neurological organ.
Hmm.
They can sense, they can talk to our brain. And our upper teeth is a representative of our skull, the alignment.
Wow, I
The
don't know.
bottom teeth actually representative of our body. So when our head and body alignment, that eventually meet our joint, which is people call that TMJ, and just
Hmm.
clicking, popping. So what's the big deal?
I
But
struggle with TM. I have some TMJ. Sometimes
uh,
I know my wife also struggles with TMJ because you do it without noticing. You'll sit and you'll clinch from stress
hey,
without even knowing.
so so when we talking about our teeth, moving the teeth, disregarding our jaw alignment, and you can have a beautiful teeth alignment because traditional orthodontics aim is make teeth, upper teeth and lower teeth and midline straight.
Hmm.
That's it. And
That's it.
but
It
that's
doesn't
not
take the rest into consideration. It doesn't take
that's
the rest.
not. It's not
Yeah.
their fault. It just that's the education we have. It's traditional education, not understanding whole body system.
Mm.
And this either I'm okay with the I have a braces 3 times. We also offer the braces, but we cannot put the straight teeth on the crooked face.
Mm.
We make
Mm.
our face symmetrical online first,
And then straighten it.
then we can straighten the teeth. There will be no harm. But just make the teeth pretty and straight, even kind of all on four. There's a take all the
Mm-hmm.
teeth out, to make the some implant and lock the jaw. Maybe you can be beautiful, but when our body is not functioning, that can break them apart too.
Mm.
Not understanding how our body working properly, systemically, head to toe. So when I approach these days, when I look at the people, I'm looking at the people, not only looking at the teeth, I'm looking at
At the
whole posture. Can you walk? And I have some muscle tests, which side they are dominantly used to compensating the other side. Do you have a hip issue?
and then
Yeah,
but that tells you the story. That tells you the story.
it's just when I meet them, I just see where they are, but I really don't know what kind of traumatic event got got for them to be here.
Mm.
And there's of course I have to listen what they have. They have a shoulder issue, some the surgery, accident. Braces can be a traumatic event too if we
Mm.
do not understand that. And just have a listening to their story to figure out then what's the next. Where do we start? That
So would you rather, sorry to interrupt you. So something that you said that I really liked, you spoke about before even looking at the teeth, you look at the face and the symmetry of the face. And from my understanding, one treatment that you've really started focusing on that interests you is the homeoblock. Does that appliance tie into first looking at the symmetry of the face, or where does the homeoblock treatment fit into this holistic approach to straightening teeth and overall health?
So Homeoblock is a oral appliance, oral device, and promoting bone growth in a symmetrical way, which is jaw development and facial symmetrical. But what I'm trying to achieve, make the form right, then function will follow. The what event and ultimate goal for this treatment, we're gonna analyze our face. Of course, almost everyone is asymmetrical. And what's the play role? That means facial symmetrical means so some other area either twisted or kind of slanted, and there's a different way of our skull is positioned, then we have to figure out what was going on. After that, that homeoblock is using our own ability of developing the jaw in a symmetrical way because we have a DNA inside of that. It's God given. You have it. Everyone have it, but just everyone has it. But just we did not had a chance to develop them. So it's the epigenetic appliances, which is talking to our DNA, okay, add a bone where it's needed. I don't know
Mm.
when they and how they're gonna add a bone, but we just send the signal for them to turn on the switch. Then the wearing during the nighttime, that certain movement in our body will send the signal to our the DNA and it will add a bone where it need to be.
Mm.
It's just and it's amazing what it can do. What so eventually when we reach that facial symmetrical, what I'm really trying to do is that will make our nerve system functioning. Because when our alignment is not in there, is wrong, that make our autonomic nervous system is dysfunctioning. When autonomic, so I know it's a big word, but autonomic nervous system has a two branch, which is one is sympathetic, the other one is parasympathetic. So one of the big nerve of our cranial to all the way down, the longest nerve is a vagus nerve, which is a cranial number 10.
Hmm.
That control our parasympathetic nervous system, which is that's a rest and digest. When the system is dysfunctioning because of our alignment, then our sympathetic autonomic nervous system is take over. The sympathetic nervous system is there is a bear, run.
Okay.
We need that system when we're in danger. Most of the time, we don't need that. But many
Correct.
people life is override because it's under control the sympathetic nervous system. They make our bodies overstimulated for many other reasons, which is that make our body sick.
Mm.
When you're talking about high blood pressure, any metabolic disease, and then what's the root cause of that? There's a one way of our body trying to talking to ourselves. They need the help. We need the help. We need to change something. But put that in that system, we put the medication. That's not the right way of treating our body. We have to look for okay, what is happening in the first place? Our
Mm.
body doesn't want to use too much energy for just make your pump your heart so much that blood to go to your brain. They don't have to
Why
do
is
that.
that? Yeah. Why is that happening?
Why?
Mm.
Why the
Mm.
first then we so when we this homeoblock when we make that our facial make more symmetrical, then when you have a foam is more either way, then
Mm.
around the system is working properly. Then when our body and also inside of that skull there's a brain. When we have a right form, then all of the brain function will be function properly. And we have ability to heal ourselves. We
Mm.
have an amazing ability to heal ourselves. We need to promoting that. So homeoblock is the ultimate goal is improving autonomic nervous system. It's
That's
just not
amazing.
yeah, it's not only for make your jaw develop and have a big smile, pretty smile. That's outcome of that. But
Mm.
goal is to improve autonomic nervous system.
Well, and this sounds like real advanced dentistry to me. This is the next level of how we should be thinking about dentistry. It's not It shouldn't just be my teeth need to look better and are your teeth healthy. It's how is this interacting with the rest of your body and what can we do, as you were saying, whether it's even how do you walk, or here we have this appliance, the homeoblock device, and so this is where we start. Like taking that approach just sounds, it doesn't sound like something most dentists are doing, because I don't think dentistry has evolved to that point. Is that your opinion too? Where would you say is dentistry at this point when it comes to having these kinds of conversations? It's not about the look and just the healthy teeth. It's about how am I helping this person overall, and what I will do here, how will it affect their little toe? Do you think that are these conversations being had?
I I mean, I'm so yeah, I love that you understand the whole thing. You just said it right. Because as a dentist, our role is just we are not his mechanic. I
Mm,
hope everyone get rid of the thought of okay, we are teeth doctor. And no. We are, if you consider that, we are actually neurologist.
mm,
Because this is a whole autonomic system. As a dentist, we have a many way to approach that very readily, because teeth function, for me, is teeth, the most important function is really stabilizing our skull. And I mentioned that our teeth are neurological organ. We can utilize it in so many ways. So eventually I feel like dentists, we are healer for humanity.
of
And
course.
we are, yeah, so many. But another way of I want my colleague, my, I mean, the fellow dentist to think them as just get rid of that just dentist. Get rid of that word. No. We are truly, main player. We are quarterback of whole system. We diagnose something. Okay, your teeth. Oh, their jaw alignment. If you start to looking at people, not the teeth, there's so much clue that we can approach the patient, improving their really whole body, healthy life. And we also need to talk to other professionals, because when we do the homeoblock, when I do the homeoblock, it's just not dentist job. I have to work with a chiropractor.
Of
Okay,
course, I was going to ask you that.
yeah,
Everything you were saying, I was going to say, do you work with chiropractors on this as well? Because it sounds like you need essentially the expertise of about three or four different
right.
specialists
Yeah,
to
so
be
yeah,
able to really heal
yeah.
someone's
You
body
you
and
just
oral
said it
health.
right. Yeah. So yeah, and then so I would love to work with the functioning doctors, not just keeping on medication, hence what's going on, and also sleep doctors, because when we have an airway issue, directly connected to our sleep, quality of the sleep. So I want to work with the sleep doctor, and not only the foot doctor, because back of your tongue all the way down to connected to your toe. So we
Mm,
need to make that alignment. And also when our autonomic nervous system is not functioning, part of that is really mental health. Anxiety, depression, panic attack is part of that. The autonomic nervous system is just not functioning well. So we don't want to put the medication because we are depression. How many people are taking depression medication?
mm,
Not only other
yeah,
kids, kids, for the young kids, when their behavior, when they have an overactive child,
it's just
ADHD,
medication. Everything is medication,
yeah,
and
they
which I
late.
do not agree with. For the record, I do not. I think that that is a plaster. It is not healing it. Yes, you can maybe put a plaster on that, but that wound, whether it's the
No,
like you said, the issues with the TMJ, whether it's the issues with the anxiety that stems from all of these different complications, like just drinking medication will not take away the
no,
underlying issue that's causing that, the clenching, or that's causing the headaches,
right.
or that's causing the backaches, or that's
Yeah.
connected to the mouth. Yeah.
Even the kids, it was so sad that, young healthy child, something they just cannot sleep well. When they cannot sleep well, it make our nervous system is all over the place. It's not in the stable condition.
Hmm.
That it lead to behavior issue, like aggressive behavior. They cannot have a, follow the rule, all that. But it's nothing to do with their ability. It's just we need to make them sleep better. And if we don't have enough jaw development, they have opened their mouth, then they don't have good breathing. It's all related to that. But I'm so sad that people, even young age, they can medicate it. First, start with the ADHD medication. If
Mm.
one doesn't work, what they do?
The
They add.
next,
I mean,
yeah, up the dose. Yeah.
yeah. If that doesn't work, they the second one they make a cocktail. If that doesn't work, they put the antidepressant medication there.
And they're on 20 pills by the time that they're 18 years old, which is unnecessary.
And we are labeling them by ADHD, right?
ADHD. Yeah, yeah, yeah,
What?
yeah.
I'm so mad this system that we are not really looking for the root cause of why kids behave like that. I just mom, please just look at your child and see if they can sleep well. Are they snoring? Are they
Mm.
grinding? That's not normal behavior. Maybe we can help for them to just sleep well. Rest of the body will adjust that. You can have a different child day and
Mm.
night. That's what I'm seeking a better answer. And there is a better answer. I'm not saying homeopathy block can solve every problem. No, this is wrong. One can solve everything. But opening our eyes, opening our mind, and just put down our ego. And if you start to look at whole person, not specialty means we only look at one part of it. Eye doctor only look at the eye. Teeth doctor only look at the teeth.
Look at the teeth. Mm-hmm.
Foot doctor, look at the
Look at
then the internal doctor, they're looking for inside of heart or that, but isn't there our body all connected?
Yeah, of
It's not
course.
time for us
Of
to
course.
talk to each other. Okay,
To
so
understand it better.
yeah,
Yes, of course.
I don't know about chiropractic that much, but at least I understand. I'm willing to talk to chiropractor who will understand what dentists can do to their patient to make things stabilizing.
Mm. Mm.
Then it's easy to work with. There's a lot of patients, they have no good answer for their body. They are sick, so they started some medication. They develop other symptom. They put the other medication. I have patient about to laundry list of medication, but every time I see them in 6 months later, they add one more medication.
Oh,
Isn't it too
yeah.
sad? And their body is all puffy and it's not functioning. They're miserable, but
You
what they're
can't just keep drinking drugs. That's the thing. You can't just add more
so,
drugs and thinking it's going to solve the problem.
so I hope you even patient who's struggling from I really have no answer. I'm seeing so many doctors, so many specialists, but I wish we can all talk
Come together and talk.
come
And you've
together.
said,
Hmm.
Dr. Jung, did you not? Now that you mentioned that about success stories, you mentioned to me at some point a success story with a gentleman that came to you that literally cried after he did the treatment with you because he said for the first time he could breathe again. Can you remind me of that
Oh
story
yeah.
about how what an incredible testimony that is to why holistic dentistry does work and it is important.
So this gentleman simply he had big thick tongue. How do I know that? Because side of his tongue has a scallop. I hope
Hmm.
everyone, yeah, it's just the tongue is, tongue is not big. Our jaw is just small, right? But because tongue is fighting for the space, they make the indentation because if they push against the teeth, they create the indentation of the side of your tongue. Then I just simply recognize that and okay. And he has a really flat teeth. Our teeth has a mountains and bellies and a lot of foam. And that's all flat because it's grinding, clenching too much. So just simply I recommend the POD, just preventive oral device. That's a myofunctional oral device. You can put it during the nighttime. It's this replacement of night guard in my practice. What it does, it creates a tongue space. And there is a one block. It's a very simple design. And also I have to do the muscle test and which side he's dominantly using it. So when I put the block, the weak side, then make our body stronger in both sides. And that talking to our brain that, okay, utilize the other side, you have a two side, right? And also it make tongue to be certain position. little up and forward. That open up the airway. Because one of the reasons we are grinding and clinching during the nighttime, when we teeth together, that make our tongue contracted and open up the airway. Just trying to breathing better. Our body, our brain trying to fighting for the, they are fighting for the breathing basically. So this gentleman is a simple and it doesn't require 1 to 2 years of treatment. You're just wearing the nighttime. So we fabricating that and he wearing it. 1 week later, I got a call and he talked to me that I don't know what the thing is. I finally get to sleep. In the last 30 years, he never had a good night's sleep. And he finally had a sleep that I don't know what it is, but thank you so much. And it has been 1 week he's wearing it, and every morning he wake up and talk to his wife that I can sleep. And finally he's gaining some weight because that was one of his issue. He just so skinny, but he never gained his weight back. But he's slowly gaining his weight back
Wow.
and just sleeping better. Just simple one thing.
And sleep is so important. I mean, it's
It
so
is.
important.
Yeah, so sleep apnea is really, that's one thing I also very passionate about it because 80% of sleep apnea people is undiagnosed.
Wow,
Yeah.
80% of people with sleep apnea do not know that they have sleep apnea.
That include me. So actually,
Well,
I mean, seriously, 2 weeks ago, I had a home sleep test. It's a simple ring. I in my age, when you wake up in the middle of the night and you cannot go back to sleep, it's very common for many people. But I thought, why are you sleeping? I thought I'm sleeping good, but I was not. My husband is worse. But it was eye opening that how many times I wake up, how many times I cannot breathe through that time. But also the diagnosis of sleep apnea is just way beyond the realistic because being mild form of sleep apnea means 1 hour. If you wake up 15 times in 1 hour and stop breathing for 10 seconds, that count as a mild sleep apnea. Does it mild to you? You
that's a
don't
lot.
1 hour, you don't breathe for times? How is it mild? That
Yeah, that
stage
is not mild.
no, the stage of mild, the moderate and severe sleep apnea, even that is not the right way. And is maybe we can put that as a stage 1 sleep apnea. Just like when
Mm.
you have a stage 1 cancer. Are you going to wait until you being a stage 4 cancer to treat them? It's just so wrong how this medical system designed to help people have a sleep apnea, but oh, you're mild. It's not treatment for you.
No, you should. Yeah, yeah.
It's just so many ways. I'm not saying all doctor is wrong. I'm saying that this is we have
We
been
we
taught.
need to talk about it. We need to talk about it. We
We,
need
we
to
need to
talk about
open
it.
up our mind. We need to open up our minds and talk together to help people in the most natural and healthy way.
Mm. Mm. I absolutely love that. And on that note, I think we can end it because if we don't, I'm going to keep talking to you for the next 3 to 4 hours because this is just fascinating. Dr. Jung, thank you so much for your time and for joining us today. I'm sure our listeners are absolutely going to love your expertise. I love the way that you look at dentistry. I admire you in your mission and how you look at things. Please never stop. Please keep going because from what you've told me and the things that people struggle with, even family members of mine, that just some of the things you mentioned, it's people like you that's going to change the scene of dentistry and get people to see it not just as you're not just treating two sets of teeth and there's a protoplasm around it. There's a person, and the holistic health approach is one. I think that is the next step in dentistry, and I'm so excited to see where it goes.
Thank you so much, Ian. It was great to
Thank
talk
you.
to you.
Awesome. Goodbye.
Okay, bye.